Hey everyone, what's up? This is Dr. Charlie Johnson, PT. Appreciate you checking out my channel. Wanted to shoot a video today to share with you a subtle mindset shift that needs to occur if you really want the best chance of solving any type of back, butt, and/or sciatica problem, especially if it's chronic and just sticking around. So specifically, I'm going to chat with you about the importance of using treatment as a tool rather than a weapon. So tools versus weapons today, folks. And look, I know that makes no sense to you at the moment, but I promise it will make more sense and be of vital importance to you as you go throughout this video and something you can chew on. So also be sure to stick around because I am going to share an actual discussion that I had with one of the members inside of my private coaching program, the Glute Relief Accelerator program. And he was able to shift his mindset from using treatments and using different techniques as a weapon to try to fend off or fight off his pain to using them as a tool, really one that he worked with to begin solving his problem. So again, a subtle shift will make more sense as we go throughout this, but basically he was able to resolve many, many years of back pain within a week of just switching around his mindset and making a paradigm shift. So look, I know this will be useful for you if you're stuck in pain. So listen closely and pull out the nuggets. Oh, and real quick, if you have not yet checked out my DIY diagnostic guide and you're still stuck trying to figure out what the heck could be going on, then please click above, download that. It's a really cool resource that lets you inside my head and helps you figure out what the cause of your pain could be. And if you're interested in chatting with me more directly and want to get more clarity again on what's going on there, then feel free to join my free DIY diagnostic network. It's a free Facebook group. You can again click above and or check out the links in the description. Click there to join. All right, everyone. So let's dive into it. Tools versus weapons. What the heck do I mean? What does it mean for your recovery? So let's chat about it and get some clarity for you. So look, I want to start this off with a question. All right. So if you're experiencing pain, what's the point of doing all this stuff? Countless sheets of exercises, right? Very common with physical therapy. Chiropractic, right? Going there 2-3 times a week, maybe forever, for the last 10 years, something like that to get adjustments. Having somebody dig their elbow into your butt cheek, it hurts so good, but it still hurts. What about these epidurals or these spinal injections? And why do we do acupuncture, right? Why do we do all these things? Do we do it for fun because we really want to do it? Heck no, of course not. Absolutely not, right? We do it to make pain go away. That's probably why you're doing it. And so look, there's no doubt that back pain and sciatica sucks, right? But if you've been struggling with it for some time, trying to beat, fight, or fend off your pain is likely to make things worse. So having the mentality of a sciatica warrior, warriors go to war, they fight things, right? And, when I think of warrior and when I think of war, I think of like very threatening situations. It already puts me on high alert. Like I wouldn't want to go do that. All right. So kudos to folks who do that. And I really appreciate the service. But at the end of the day, you don't want to be a sciatica warrior. Okay. And here's why, right? And just a subtle but very powerful shift in the way you approach solving your issue. Tools versus weapons. So look, tools are things that you use to help make something easier. And weapons are things you use to destroy, fight, or fend off something. So tools are things you work with, and weapons are things you use to fight against. Again, subtle shift in the way you think about these things and the way that you want to approach treatment. Again, a very important distinction to make. It could mean all the difference for your recovery. So by using exercise and other means of treatment as weapons, you'll see what Justin was trying here in a moment. Instead of tools to try to get rid of or eliminate your pain, you may actually be reinforcing your pain and inviting it to stay. So you don't try to fight off or defend something, right, that you're not afraid of or that you don't like. So using treatment in this way, using treatment as a weapon reinforces that which you're fighting, pain, as something that is dangerous. It fuels it with fear and attention and conditions your brain that the sensation you're experiencing equals danger. And pain is just a danger signal. Once you stop reinforcing it, it dies. So are you using treatment as a tool or as a weapon? Something to chew on. And so in a moment here, I'm going to review a live case study. And so I want to introduce you to Justin. Meet Justin, everyone. And so Justin filled out an application for my Glute Relief Accelerator program, my private coaching program, on Monday the 20th. You can see here, right, what specifically are we wanting to achieve? I want to be able to stand and sit, right, without having LBP, low back pain, and hip tightness, right? What's stopping you from getting out of pain? I don't know the answers. I've been tackling this from many different angles. I'm a 4th-year med student. He will be a spine surgeon, right? So he kind of already has this perspective, right, of what we'll be doing and how we'll be going about solving it, right? and he's really committed to fixing the problem. But he's clearly not getting to the root cause, as he admits down the bottom, right? I've done loads of research myself, but unable to crack my own code, so to speak. Surprise, as a surgeon, he's thinking very structural. Long versus short piriformis syndrome, what could it be, right? And so he's gone down that rabbit hole. Took him 9 days and 3 or 4 calls later to actually convince him to come into the program, because I knew that it could help him, right? But he had some other stuff to think about. So he said, hey, man, thanks for talking yesterday, sir. It is done. Basically, I want in on the program. We dealt with payment when we started enrollment, and he said, excited to get started. All right. So look, watch, listen, and learn as I explain the concept of tools versus weapons to Justin, and also hear what happens to him after just 1 week of enrolling in the program and shifting his mindset. All right. Really cool stuff. And he is just amazed at the progress and the results from just this little tweak. All right. So let's check that out now.
See what you're saying. I'm in the OR. It's a couple of hours deep. My low back starts hurting. And then I'm like, God damn it. Like I have like 8 hours left. My low back's killing me. Like,
are you doing the surgery?
Yeah. Yeah. So I'll be in the OR either. And obviously I'm not doing the surgery. Like I'm not doing the main parts of it, but I'll help here and there. I'll suction, I'll hold the retractor, I'll suture skin, whatever.
Do you have any breaks where you're not doing that? Where you're observing more so?
Yes. Yeah, for sure.
Okay, cool.
For
cool.
sure.
Good. So yeah.
And that's when it's the worst. But then that's when I'm like what, like, I guess I believe you in that there's obviously techniques that are evidence-based, like you said, but I'm just curious, like, what is something that like you would teach me to do, like in that situation where I'm standing there scrubbed in, my back's killing me. And I'm trying to what I try to do is I try to like stretch my hamstring. I try to,
don't do that.
Okay.
Yeah. So right there, what's happening is that you're fueling, like, let me ask you this, like, a problem doesn't become a problem until you make it a problem.
Yeah.
Right. So what happens is that pain, right? If there's some type of learned component, if there's some type of conditioned response, if there's some type of, if you want to call it for lack of better terms, a brain-driven pain, okay?
Yeah.
Then what will happen is that it'll be fueled by the reaction that you give it with fear, worry, concern, attention, right? So now here's the thing. What's different is that it doesn't mean ignore it. In fact, I would actually ask, instead of your traditional way of trying to fight it, right now you're trying to fight it off. You're not doing that stretch because like you want to.
Correct. Yeah.
Who the hell does that? Okay. Like you're doing that stretch because you think that it's a sword, and if you do it, it'll reduce some symptoms.
Yeah. Correct.
Yeah. And so if I'm a bully and you're the person I'm trying to bully, what do I want? Do I want you to react? Of course I do.
Yeah.
Yeah, you're fun to pick on.
Yeah.
Right. But if you don't react, how fun are you to pick on?
Yeah, you move on.
Right. So as soon as you neutralize things by not responding, right? So my daughter comes home the other day and she said, Leah told me that she'd never let me go down the slide, and then she pushed me. I said, yeah, cool. I mean, see, so imagine if you just responded and you said, cool, and you just looked at him, you walked away, right? Yeah. Leah wouldn't even pick on you probably after. Now, they would initially, right? Because human behavior is this, man. What happens is that if you have a child and they throw a tantrum, okay, and you give them a piece of candy every time they throw the tantrum, right? What happens? They throw the tantrum and positive feedback loop, right? So if every time Justin starts to feel sensations and he goes and he does this stuff, now it could be a hamstring stretch, it could be like he wants to like do this thing or look online or whatever, okay? He fuels it with some type of feedback there, right? Then it strengthens that over time and it becomes a learned response. So then what you start to do is, and here's where people get really screwed up, is because people will say like, this is getting worse, and like, it's not working, it's getting worse, your approach doesn't work. No, here's what's happening. That's called an extinction burst. So if you understand anything about human psychology, what you'll recognize is that you have child tantrum. Every time the child throws tantrum, you give them candy. Well, what happens when you stop giving them candy? Do you think that they start to scream louder, or they're like, the first time they're like, totally cool, no problem?
Yeah, they scream louder.
They freaking scream louder. So it gets worse before it gets better. So what happens is when you break a negative feedback loop, in this case, human behavior of child tantrum, rat would do the same thing. Give rat running on treadmill, food pellet, take food pellet away. Rat runs harder.
Yeah.
Because rat's like, I should be getting some food out of this.
Yeah.
Right. So at the end of the day, right, like, what can happen is that when you start to break this behavioral pattern, right? You start to starve it of that which it is used to, right? You can actually intensify symptoms. So you don't want to ignore this thing, right? Because like that doesn't really work. You don't want to reinforce it by doing more per se to try to get rid of it, because you're using it as a weapon, a hamstring stretch in this case, or
Yeah.
maybe the way you're like wiggling or doing whatever. Yeah, I know. Okay.
Right.
So instead what you would say is, hey, and it depends, there's an art to this. If symptoms are too bad, this doesn't work. If symptoms are mild and tolerable and you're like, they're uncomfortable and I don't really like it, and I would want to maybe wiggle out of this, or in the past I would fight or flight, flee from this, try to fight it, whatever, right? Instead, you start to use things as tools. So instead of trying to fight this thing, the more you fight this thing, the more you reinforce that it's something that's dangerous and needs to go away. So instead, I would say, hey man, lean into that thing. Don't lean out of it. Don't try to do something to get it to go away. Instead, I want you to sense what you're feeling right now.
Literally life-changing. Man, to be honest with you, like the only thing that I haven't tested yet right now is the standing in the OR. That's the only thing, right? Because like I'm not on service right now, so I'm not like, you know, standing there for
it's
hours.
difficult to test. Yeah.
Difficult to test, and I should test it. But to be honest with you, like I'm almost like 100% better. I'm not kidding you. I'm not kidding you.
Hold on. Did I hear that? Did I hear that?
You did. You did.
All
and,
right.
and you know what? It's just been like, and I haven't even learned all the tools yet, you know? I'm just starting phase 1 now. I just finished all the onboarding stuff and the, you know, the healing log and whatnot. But it's just been, the biggest thing for me has just been a shift in the mindset, right? So now I'm just like, all right, you know, so
Cool,
be it, right?
Cool, Justin. Yeah.
Yeah, cool, right? So, I mean, yesterday was, like the last couple of days I've been able to study sitting, and I just like, I don't even worry about my hips getting tight or my low back hurting. And then it doesn't happen.
Yeah, it's cool.
It's just, it's truly amazing. And of course, you know, it's been a week where I've really dialed in. So wow is all I gotta say. But of course, it's just been a week, so we'll see how things go, right?
So hopefully you found that useful and just fascinating, right? Really cool stuff when you can help people who've had pain for that long, right? That quickly. And look, I'm not saying it always happens that quickly, but in many cases, especially if pain is chronic, the pain lives on just because of how you react to it and the meaning you give to it. So it's not your fault, but it is the result of lots and lots of practice. So when you feel pain, it triggers a familiar thought and reaction. It becomes reinforced over and over and over again. So pain is a sensation plus some danger signal. It could be fear, it could be worry, it could be concern, it could be frustration, anger, whatever it is, some danger signal. And in Justin's case, as soon as he became indifferent, notice how he's just like, cool. As soon as he became indifferent to the sensations he was experiencing, 10 years of pain diminished rapidly, almost 100% in a week. How's that possible? This is it. So he stopped trying to run away from his pain and quit grappling with it. He dropped his weapons and surrendered. So basically, he neutralized the fear associated with his pain, and he was just left with a sensation. That's it. So pain is a sensation plus a danger signal. Danger signal went away. You're just left with a feeling. And guess what? We all have feelings every moment of the day. It goes away when you detach it from that danger signal. It just becomes a sensation, right? And a sensation is neither good nor bad. It's just meaningless. It only becomes meaningful if you ascribe it to be meaningful. A problem only becomes a problem if you make it a problem. And you saw me chat with Justin about this. So for example, as I sit here right now, or as I stand here, but as I was writing this, right? I felt the roughness of the chair on my upper leg and something touching the lower part of my leg. It feels neutral and normal. And I'm not freaked out by it. I just notice it. But if I was sitting in the woods and felt the same sensation on my lower leg, right? Something kind of like touching it or brushing on it, then I'd probably move very quickly and I'd try to like flick it off or do something like that, because there would be a sensation coupled with some type of fear or worry, concern about there being a tick or a bug or some nasty spider or something like that. Or this is interesting, right? Not sure if you ever thought of things like this, but look, maybe you've had a long day at the beach and sort of the rubbing of the t-shirt on your shoulder might be causing soreness because of the sunburn on your back. But then on a cool, crisp day, right, I'd happily take a dip, or maybe you've taken a dip in a hot jacuzzi to willingly experience that same burning sensation because it feels good, right? So similar sensation, burning on the skin, but different experience. So it's all contextual, folks. So one is good, that you classified as good, and the other is bad. Interesting stuff. So hopefully this makes sense. And this is just something to practice, right? So just like Justin started, right? So the next time you experience, right, the familiar sensation of pain or whatever it is, while walking, standing, sitting, driving, bending, lifting, whatever, if tolerable, don't run from it immediately. Instead, explore it and take note of what it does. Does it move? Does it grow? Does it shrink? Does it travel? What does it do? And attempt to view it with curiosity instead of fear. Like you're watching a sunset or clouds pass by. So you shouldn't be watching a sensation like you're trying to study for an exam. Too much intensity. Attempt to view it as if, again, you're watching a sunset. You're taking it in, but you're not like looking at one specific thing. You're just seeing the sunset for what it is. And or you're watching the clouds pass by. Be more lighthearted about it if you can, and just observe it. And instead of running away from it, lean into it. And that's it. So look, if you want to begin the process of learning how to fix yourself, like Justin has, and Justin tried lots of stuff, worked with lots of really smart people, then I'd recommend you register for my free workshop. This doesn't have to be difficult, folks. Less is more. And often the simplest solution is the best solution. For Justin, one thing. No motion, one thing. That's it. Right? So look, at the end of the workshop, I will invite you to apply to work with me inside the Glute Relief Accelerator program. Again, a private program where I teach people all over the world how to fix themselves so they don't need to rely on other folks to fix them, and or they don't need pill shots or surgery. So that is the intent of working with me, is if you're interested in learning what you can do to begin solving your problem, and you want to be accountable and are willing to put in the work, then I'd love the chance to chat with you. That being said, there's no pressure. If you're like, hey man, don't want to work with you, that's fine. Keep doing what you're doing. If you'd like to chat with me, and or you're interested because you've been stuck in pain for a while now and have tried lots of different things, then it's probably worthwhile having a chat to see if how I can help. All right, so check that out. Again, you will see the link in the description. I'll probably put it up here too, as far as the workshop. And this is what you'll see when you go to register for that workshop, and you can just click the register now. So that's all, folks. So that is the secret behind how Justin was able to resolve many, many years of back pain, and much, much worse back pain, like back pain that was worsening in the past year. And he was able to stop things, right, from going further down the hill and completely reverse them to a point where he's almost pain-free in 7 days just by switching his mindset. So this is not woo-woo stuff. This is stuff that is very evidence-based, very well supported within the research, but it's just not widely known. So look, subtle shift, you can do it too. If a spine surgeon can change their view on pain and what it means, right, I know you can do it as well. So again, like and or comment below. Would love if you subscribe to my channel. And if you're interested in working with me personally, again, there are links below, but check out my workshop, and it is free. And you know, at the end, I will invite you to work with me. If you'd like, great. There will be instructions there. If not, then no worries. All right, everyone, until next time, chat soon.